Welcome to another episode, I think our fourth episode of the Movement Revisionist podcast, where I help you redefine human movement and performance one episode at a time. I'm rambling. Let's get into our guest and who we have on, the one and only Nicole Lorenz. So,
Hi.
Nicole, just tell us what you're about before we get into our topic.
Nicole Lorenz. I'm a physical therapist. I specialize in orthopedic and pelvic floor physical therapy, and I'm also a certified Pilates instructor.
So many qualifications, ball of knowledge, especially when it comes to pelvic floor. Well, you're a pelvic floor PT specialist. You've taught me so many things over the years because we've co-managed a lot of patients together. So I really wanted to have you on, and the one topic that really interested me through our just private conversations is rehabbing the pelvic floor postpartum or right after pregnancy.
Yeah.
It's probably quite the topic, but I figured you were the person to have on to start talking about it.
That's a big topic to talk about, but it's so important. Thankfully, we're starting to see a lot more focus on rehabbing postpartum, treating it like it's a normal part of care, the way you would rehab after an ACL injury or a shoulder reconstruction or something like that. Mm-hmm. And in Europe and Australia, it's a little bit more standard for a patient to go in maybe at 6 weeks and have a physical therapy appointment.
Yep. Mostly
sometimes just to get a checkup, make sure that everything is going well, given a few bits of advice, and maybe end it there. Or if things are found in that first 6 weeks, addressing them then instead of letting them persist.
Yeah. Well, talking to you, when it comes to the pelvic floor, it might not tell you in the moment that something's not working properly. Could be something that, manifests for a long period of time. Yeah. Or we just think, oh, that's just part of getting old, right?
Yes.
So, well, what about a quick synopsis? I know you didn't bring your model, but next time we'll get into the specifics of the pelvic floor structure next time. But can you give us a rundown of what the heck is the pelvic floor?
What is a pelvic floor?
Yes.
So the pelvic floor is made up of essentially a bowl-like structure of muscle that, extends through the pelvis in a 360-degree type of fashion. And its primary function is supporting pelvic organs, managing bowel and bladder function, and of course also managing intimate function as well. Mm-hmm. And any and all of those things can be disrupted in pregnancy and in that postnatal time frame, and whether it's immediately postnatal or down the line, because once you've been pregnant, then your time frame of being postpartum is kind of forever.
Mm-hmm. Yeah, especially if there's not a step-by-step process to get back to what your function was beforehand, right? Yeah. So what a beautiful segue into, you mentioned how it's more mainstream maybe in like European countries, but if this was your ideal situation here in the States, because that's where we are, what would a postpartum PT evaluation and kind of treatment process look like? And I know there's going to be, it depends on the individual, but
it does.
Trying to make it as black and white for the people out there as possible.
So ideally what we'd like to start seeing even more of, and there are some great OB midwife practitioners already on board with this, but it's standard practice for a patient postpartum to get to get an evaluation at 6 weeks with their OB or with their midwife, some sort of OB-GYN practitioner. Mm-hmm. And then as a pelvic floor PT, I'd like to see them get a script and be directed to see a pelvic floor physical therapist of their choice, or somebody that the OB is comfortable with, knowledgeable with, so that everybody is just kind of as a standard of care being seen by a pelvic floor PT. OBs and midwives have their specialty. We need them, and they're very good at making sure that we have safe, healthy pregnancies and deliveries. They're checking for a lot of other, life managing diagnoses and scenarios, but getting a patient back to movement and functional movement, that's where PTs have a specialty.
Yeah, and that's where I from the outside, I see that gap where obviously going through a pregnancy, the number one goal, healthy birth, healthy baby.
Healthy mom and baby, that's like top.
Yes, understandably
Yeah.
so. But when you're, especially if it's like your first pregnancy and you're already living an active lifestyle beforehand, and then from my experience treating a lot of postpartum females, they want to get right back into whatever they were doing beforehand. So that's where trying to get more specifics, maybe things we should look for. I like the 6 weeks. I think, I'm guessing there's some sort of rebounding effect that takes place within that time. But what specifics are you looking for at that 6 weeks post-pregnancy?
So that 6-week visit for me would look like a full assessment, and that's head to toe. So I'm trying to find out like where the mom is at with sleep, nutrition, hydration, breastfeeding status, whether they're breastfeeding or not breastfeeding, because that's going to impact hydration, nutrition, and hormonal environment. And that does play a big role in that postpartum time frame. So getting a subjective history, getting an idea of what life looks like for them in that moment, because that's really important. Are they supported? Do they have great support? Are there resources that we can provide? Mm-hmm. And then getting into more of the objective measures of how are they moving globally. So I have a bit of my own, movement assessment from head to toe, looking at spinal movement, hip and extremity movement, and then I look at breath pattern, make sure all of those things are checking the box. And then part of a pelvic floor physical therapy appointment can be an internal assessment, at which point we're assessing for pain, we're assessing for volitional strength of the pelvic floor, endurance of the pelvic floor, coordination of the patient's ability to engage the musculature, relax it back to a baseline, and let it relax and elongate to its longest position of the musculature.
Yeah,
So,
not just, trying to get that Kegel contraction, which I know we've had
We've talked about the
separate
Kegels.
conversations. Maybe we can go into that on a different episode. But yeah, not just trying to contract it, but also allow it to relax. And is that, with postpartum, do you find more the pelvic floor is too contracted, too loose, or a combination?
It's a mixture, and it depends on method of delivery. Did the woman have a cesarean section, or did she have a natural vaginal delivery? That's going to impact what happened with the pelvic floor musculature. So taking that into consideration. It's not so much that I see a lot of true weakness when we're pregnant. Everything kind of extends. So those muscles have lost their length tension relationship. So they're weak because they are still trying to come back to that homeostasis.
Right.
And that's where, whether we're trying to engage the pelvic floor or relax the pelvic floor, that's the basis of my clinical reasoning. Where are we at? Are we tight because maybe we've been reacting to pain postpartum? Are we a little bit weak and extended because we just haven't bounced back to that proper, again, length tension relationship of where the muscles work and support the body the best?
All right, Nicole, next question. Just because, I think both of us see a more active lifestyle demographic. What if, especially if this is first pregnancy, if someone's super active, let's just give, they work out 3 to 4 days, maybe like a general strength training routine. What does that return to their sport or activity look like after the pregnancy?
Oh, my favorite answer. It depends.
Yes, of course.
It does depend, but somebody who is more fit and more trained going into pregnancy is more likely, not guaranteed, but more likely to have an easier birthing process, recovery process, and getting back into it. Now, that being said, there's some great research and literature that's thankfully been put together in our world to kind of give some guidance to women.
Nice.
Which is amazing. It hasn't always been there. And the general recommendation is 3 to 6 months before returning to higher level activities, things being like CrossFit and running, anything that's going to have a higher like gravitational load on that pelvic floor. But there's a ton of variability within that recommendation.
I'm
and
sure.
So thankfully, again, one of the best resources we've got has also included a lot of like tested measures to kind of look at to see where somebody might be on a spectrum of things. And so it kind of, again, comes back to your clinical reasoning, like, how is the patient presenting? Are they having any kind of dysfunction that might lead me to think the pelvic floor is a problem or involved? Let's not call it a problem, but maybe it's contributing to where they're at in their function.
Yes.
Are they having any bowel and bladder symptoms? Like, that's your number one thing that you're probably thinking pelvic floor is bowel and bladder. Are they having any feelings of heaviness, dragging within the pelvic floor? That could be a symptom of something like a prolapse. So pelvic organ prolapse would occur if there's just not the proper support of the pelvic floor, and that can be a tight pelvic floor, a weak pelvic floor, injury to pelvic floor muscle, and then any pain with intimate situations. So those are kind of like the three big categories that we're looking for.
All right. Keep a note for those at home.
If all of those kind of check that we're not really seeing issue or dysfunction there, then we move on to a little bit more objective, high-level testing. Can you walk for 30 minutes without any of those symptoms? Can you maintain balance on each leg? We have to look at both. Can you perform like 10 single-leg hops on each leg, 10 single-leg squats, some running in place, bounding type movements, and kind of taking them through that progression of activity. And then if everything is looking good, there's not any kind of movement asymmetry, weakness that we're seeing, then it doesn't necessarily depend always where they are in that 3 to 6 months period. It's if they're passing all of those tests, then we can progress them back to like easing into their movement, their favorite movement choice.
Now we let them swim in the deep end a little bit, right?
Let them swim in the deep end, and then like for my runners, I would probably start them back on like almost like a couch to 5K, a return to run program where you take that 30-minute period that they might have been walking, and now we're going to do 5 minutes of walking, a minute of jogging, and then repeat that for the 30 minutes. And then we start to tweak the walk and run period slowly back to maybe being able to jog for 30 minutes, as long as they're able to progress there without any symptoms. If you see symptoms, then we regress.
Now, and you kind of already brought it up, but I want to highlight it again. When we're getting into those higher level functions or returning them back to whatever they would like to be doing fitness-wise, what are those key symptoms that we're looking for?
Yeah. So
especially if they start to creep back up as the performance gets higher, right?
Yeah, you've got to watch that there isn't a symptom progression as you're progressing movement. Those symptoms, again, that you're watching for, like bowel and bladder symptoms. So urinary leakage, any difficulty initiating urination or bowel movements. Constipation can also be another sneaky one that we see with a tight pelvic floor. Pelvic floor is not relaxing enough, then we're going to have difficulty having a bowel movement. And then the pelvic organ prolapse, you feel more symptoms of heaviness within the pelvic floor and perineal region, maybe almost like there's tissue present where there shouldn't be. And that can depend on time of day and activity level too. Like those things can change throughout the day. So kind of being aware that presentation in the moment you're seeing them might be different than before or after they're exercising. And then the third being pain or difficulty being intimate with their partner.
Yeah, well, those are good things to make note of. And I'm sure that as you start to progress that fitness level, just because you've had a good string of weeks or even a month, you still have to pay attention. Would a good marker be, you want to be diligent on if you're feeling symptoms like 6 months afterwards? Is there key research that says, all right, once we're over this hump and we haven't had this many symptoms? I knew you were going to shake your head at me.
No,
but
you're not.
Give
There's
me
not
the
like a
details.
time frame where you're like in the clear.
But this is what people want. They want time frames.
Yeah, I know.
This is why I have you on, to kind of show you. That's like someone coming to me for low back pain. I mean, I wish every single case was black and white and I could, take it away in one visit, but there's complexity, activity level, how long's it been there? Yeah. So I'm sure this plays a role, but really what I'm identifying, because obviously I'm not your your primary demographic, is that if you have a proper evaluation, just so you know where your start point is, it is way easier to progress and get you back to those activities than just, well, hey, it's been like 2 months.
Winging
Let's
it for a
go
while.
right back to,
Yeah.
name big box fitness class gym. And then that's when I see a lot of, postpartum low back pain, just because, well, we intro that activity too soon when I think
There's
something
not
like
enough
working,
support.
yes,
Yeah, there's just
where
not.
we jump too far because everybody wants to get back to that fitness level, right?
Yeah. Yeah, we want to jump into it early. I'm certainly number one person guilty of this. You want to get back into it. And so again, for moms, like, you have to look into the lifestyle factors surrounding them in the time frame that they're at. Whether it's early postpartum and somebody's wanting to get back, I take a lot into consideration also like their mental health status. A lot of my like running moms, maybe we've used running, me in particular, running helps us manage stress and anxiety, and it's a great way to kind of burn off that extra energy from the day.
Of course.
For some of our moms, maybe if they're checking all the boxes on symptoms, but we're still a little ahead of that 3 months, I might take into consideration, like, if we get running back into their life, is that going to be a positive for them? Are we weighing your risks and benefits?
Right, you're trying to balance that scale.
Yeah, but if that can help them balance the stress piece of now being a new mom, or a mom of another kid, maybe you're having multiples, or you have already got a couple of kids at home, that can help you manage your stress. And is waiting till 3 months the most important, or is getting it back in maybe a little sooner but safely really the best strategy?
Yeah.
But then on the other end, like, it could be 6 months and I could still have somebody with symptoms, and so it's not the right time to move them into a higher level exercise. We've got to figure out how to bridge the gap safely.
Well, and that's where talking to you, I know we're focused more on that postpartum time frame, which you told me once you have, it's forever.
Postpartum is forever.
How many patients I've referred to you where they just didn't know they needed to work on their pelvic floor, especially when they're not having children anymore, where this is like decades later.
Yeah.
And we just try to resolve that missing link that they've had, and it's crazy how the outcomes occur. And guess what? I don't see them for reoccurring low back pain anymore. Probably bad financially, but I like sleeping at night, making sure everybody gets the best care possible.
Yeah, that's the important part.
Yeah, so that's where really coming down to, I mean, it's individualized. And then I'm sure, does anything change? I know I focused or teed it up more for someone having their first child. Mm-hmm. Is that get easier? See, I'm asking from the perspective of a male right now.
Right.
So does that get easier, or that rebounding effect, as you have more children, or is it just it's a reset point no matter what?
I think it's a reset point no matter what, because again, you're going to have impact to the pelvic floor because of the pregnancy alone, whether it's C-section or vaginal delivery. You're going to have impact to the pelvic floor carrying around a bowling ball for a period of time.
Okay. Yeah.
And again, with vaginal delivery, you're going to have insult to pelvic floor during that time frame. So it is a little bit of a reset. And postpartum from your second can look much different from postpartum from your first or your third. It's all different. And again, now when a mom has more than one, we're talking about a different level of lifestyle factor at home. There's more to be keeping your eye on. There's maybe
different stressors.
There's maybe a different stress level, and
Yep.
so that too will impact a patient's pelvic floor recovery. The pelvic floor response to stress. I see a lot of increased tone or upregulated nervous system and pelvic floor stuff in those who have more stress. So sometimes more kids equals more stress, and that becomes a factor.
Well, that's a good factor to know. And you've already mentioned a couple of them. I mean, when you do an assessment, I mean, you're looking at obviously the pelvic floor, but you mentioned overall health, emotional status, and kind of what their stressors are. Is there any other key factors to be aware of when it comes to contribution to pelvic floor symptoms?
There are a lot of lifestyle management things that I discuss with my patients. My favorite is the squatty potty.
Nice.
So making sure that we're in a good posture for our bowel and bladder movements.
I have one at home. I'll hand in the sky.
Oh, you have one at the office.
Oh, nice. Even better. I don't think we have one here at the office, but
Well, I'll have to bring
my
one
wife,
over next
I
time.
don't know if she's like, what the heck is this thing? But I'm like,
So yeah,
trust me.
squatty potty helps you, like lift knee to hip height, and it allows for better positioning so that you have decreased strain. And so strain or pressure down on the pelvic floor is one of those things that can contribute to a little bit more of a tissue descent, a prolapse, if the surrounding musculature isn't as supportive as it needs to be. When it comes to the topics of prolapse, we like to talk about the boat and the dock.
Tell me more.
So
I'm intrigued.
So the boat and the dock, the boat being your pelvic organs,
Mm-hmm.
and the water surrounding that being, pelvic floor musculature. And so if your pelvic floor musculature isn't supporting, then your boat might be dropping within the water. Like if you are at a low tide, boat's going to drop,
Mm-hmm.
pelvic organs are going to drop. Or if you've got a tightness to one side or the other, that's going to adjust the position of your boat, or in this case, your pelvic organs. And so
Fascinating.
pressure.
And I like analogies.
I love analogies. So pressure downward on the pelvic floor can affect the positioning of pelvic organs. Strength of the pelvic floor can affect that as well. Hydration is another big lifestyle factor I focus in on with patients, and that'll affect more of the bladder.
Should we cheers?
Cheers. Our water here. Promise
Stanley
it's
cups.
water.
That's some vodka tasting water right there.
Well, that would be a bladder irritant.
Yeah,
So
okay, all right.
highly
Yeah.
not.
So
I
we want to
don't-
avoid
don't
that
recommend
during
that.
recovery, yes.
Yeah. So especially in our breastfeeding moms, but all moms, 'cause we don't pay enough attention to ourselves most of the time, dehydration can become an issue, and then we add the coffee, and the coffee's a bladder irritant, and then now we're starting to talk about urinary leakage and urgency and frequency with our patients.
Wow, and that's something that's probably occurring every single day. So you're picking that scab whether you're even aware of it or not. So interesting. See, you teach me something new every time. I didn't even think of how, I mean, obviously we know, or we should know as a society, drinking more water has health benefits, but the combination of that, and then you have extra stress, you drink more coffee, that could lead to
Yeah.
more irritation, or at least more symptoms, I would imagine.
Yeah. Basic coffee, alcohol, some of your citrus, higher acid type food or beverage is going to be irritating to the bladder. And that's going to make you feel like you have to go to the bathroom. And whether or not you have other underlying pelvic floor issues. So oftentimes I don't like to recommend getting rid of coffee. I'm fully obsessed.
I know, me too.
I don't like to recommend that. That sounds terrible. But what I will recommend to my patients is to first maybe have a glass of water. Accompany your coffee with some water to make sure that it's diluted within the bladder, so it's less irritating to that lining of the bladder and the urethra.
Yeah.
So
So it's not like we have to give up these things.
No.
We just have to modify, especially when we're recovering from something like a pregnancy, right? Now, on the topic of just postpartum recovery, any last kind of tidbits of information? I know we've went through a lot, and I know this being in practice, it depends, but are there any key factors that people should be aware of besides, like, hey, if your OB or midwife didn't recommend a PT follow-up after 6 weeks, what are some other key details that we should know?
well, you might have to stop me, but
Hit me.
all right. So whether or not your OB gives you a script for pelvic floor physical therapy after birth, just ask for one. At your 6-week follow-up, just ask for one. It might not be a course of ongoing pelvic floor physical therapy, but it's good to get a checkup and see
Like
where
a
things
snapshot.
are at. Yeah, it's different than what your OB is looking at, and it should be. We have our different specialties. Additionally, giving yourself some grace. This is something that as moms we are really terrible at, but if you're a new mom or recently postpartum, give yourself some grace. We talk a lot about bouncing back, but it takes time, and we have to kind of honor the fact that there is tissue involvement, and we have to give those tissues their due healing time frames. It's muscle, it's ligament, it's tendon. It needs time to heal like we would give to an Achilles tendon injury. It's similar. It's still those same tissue healing qualities, and we have not really found good ways to change those time frames.
Well, and obviously there's so many factors that contribute to that. Actually, one factor that I'm just genuinely interested in is how much are hormones still playing a factor after the pregnancy? Because I know you have, relaxin, oxytocin. There we go. I remember some stuff from school.
Yep. They play a huge role, and again, this will vary if somebody is a breastfeeding individual or not. Because breastfeeding kind of creates a little bit of a de-estrogenized state within the body that very much affects our pelvic floor tissues, causing them to be a little bit more susceptible to dysfunction, dryness, irritation. And so if those are symptoms that are being experienced, following back up with an OB is probably one of my number one recommendations for patients, because we have ways to address that, both with PT and with medical management. But that's a number one. The hormonal picture is wildly fluctuating in that early postpartum time frame, and then again as we continue to breastfeed, and then as you get to a weaning stage, if you were breastfeeding, now you're going through another big hormonal shift. So it can be a long continuum.
There's some levels to this.
There's a lot of levels.
I mean, again, they're problems I'm never going to deal with, but at least keeping my wife, giving her the information before we start our family. But having an expert there along with you, especially if you want to, I would imagine we both want everybody to live more active lifestyles, but especially if you're already living a more active lifestyle and you want to get back to quote unquote your pre-pregnancy shape, which I'm sure that will bring up a whole different discussion. But
I'm almost 6 years in, still waiting.
Yes, it's all right. It's a new chapter in life, right?
You're in a different season, and I encourage people to really embrace that new season and see it as something different than trying to get back to the former, because that might be a struggle that becomes just more of a challenge than it's really worth. Like, you're in a new season, and it's its own beautiful thing. Your
focuses they should be shifted depending on what your focus was beforehand, right?
That's my own personal opinion.
Yes, I was going to say, we'll leave that for you to for interpretation. Oh, one last question. You've given me a ton of good information. Hopefully everybody else a ton of good information. What about, is there any sort of prehab measures when it comes to seeing a pelvic floor specialist before the actual birth?
Absolutely. Especially for people who might be dealing with pelvic pain, like pelvic girdle pain prenatally, low back pain, hip pain. I think it's really beneficial to talk to maybe OB, get a script, or to seek out a physical therapist or pelvic floor physical therapist prenatally too, if you're experiencing dysfunction, pain or dysfunction, whether that's with the activities that you love or just in general in your active, like daily activities of daily living.
Yeah.
There we go.
It's a tongue twister.
It is a tongue twister. In some cases, though, in a really uncomplicated pregnancy, it might not be one more thing that needs to be added to a person's schedule. I happen to be a big fan of prenatal Pilates, just for working with connecting breathing to movement and having that mind-body connection with their breath work.
Preach. I love it.
And maintaining strength and mobility so that they can, like women can have a comfortable pregnancy, because Pilates or any other functional movement, you're able to work and maintain ranges of motion better, maintain comfort better by
Well,
working
and
out.
depending on the individual, if they're already active and they already do strength training, well, you want to maintain that foundation, especially if you want to recover quicker, I would imagine. But even if you're not active, I think that's even more important to set that foundation, especially when
Yeah.
your body's going through so many changes within such a short amount of time. It still
Yeah.
blows my mind just thinking about a pregnancy, especially with what the female body goes through. But
No.
yeah, that was one more point, because I would imagine it's easier to meet with someone before birth. What are your plans afterwards? You might have to reel it in, make it more realistic, especially if
Yeah.
it's a first-time pregnancy. But then knowing exactly where they're at,
Yeah.
does that help give you a window? I know it's going to be a loaded question. Does that help give you
Okay.
a window if you see someone beforehand, what postpartum strategies are going to be like?
Yeah, absolutely. Seeing somebody beforehand is a great time to kind of see where they're at and kind of create that plan for the first few weeks, because it's not like, you know, you have the kid and now 6 weeks, you wait 6 weeks and then you start moving, or your 6-week checkup. There are things that you can be doing, you know, within the first few days postpartum, especially, again, reconnecting to breath work is probably my number one favorite. But yeah,
And it's got to be a pretty low risk, especially
slow risk.
for...
We do need to breathe.
Yes, exactly.
every day.
If you're already doing it, you might as well use it to your advantage, right?
Yeah, and we can use that breath to kind of reconnect to our core muscles that in that state are very much thrown off by their length tension relationship. It's a very sudden change in intra-abdominal volume.
I know we haven't even gone into breathing concepts. We could have so many episodes. This
So-
is crazy.
Just
That's
a
where
whole pelvic
if you want to
floor
see more
podcast.
content, definitely let us know, because I'm going to have you back on in the near future. But I wanted to try to keep it around the topic of... Yep. But it was nice to get a little pre in there too. But it makes sense to me if you get it evaluated beforehand, then, especially if you already plan on working with someone afterwards, they already have that snapshot of where you're at, what your goals are, so it's easy for you to build that program for them, because it's going to be individualized. Hopefully we've caught on, if you're still listening at this point,
Yeah.
it's going to be individualized. But I am about cutting every corner, and if you work with a specialist and you're not trying to just guess and go back to what you're doing before, you're going to get the results you're looking for, usually way faster.
Yeah.
So that's why I really wanted to have you on to discuss that.
Yeah, and like you mentioned, like everything's very individualized, and I think one of the things I get asked a lot, or that I see as a question that's out there a lot, is like, what can I do to strengthen my pelvic floor or to work on my pelvic floor? And there's, hopefully getting to this point, it's obvious there's not just like one quick thing or this cool new exercise to try and do that's going to help fix your pelvic floor. It's very much dependent on where you're at in that exact moment and what kind of factors are involved. And so,
well, it's a plan. Even if there's a quote-unquote pelvic floor specific exercise, where is that in your individual plan? Because they're, hopefully if we're listening to this and you follow either one of us, there's not a one-size-fits-all exercise. Usually it's finding where your level of fitness is, and then you can kind of gauge from there.
Working from there, yeah, absolutely.
Before we outro, one more time, let everybody know who you are, where they can find you, social handles, all that fun stuff.
Well, thank you for having me on again, Nicole.
Oh, well, thanks for blowing my mind every single time. This is not my expertise. The biggest thing I learned in my professional career is don't try to be an expert at everything.
No.
Talk to the experts, because that's where you'll learn, and stay in your lane, of course. I'm sure if I try to teach pelvic floor stability, that wouldn't connect a lot of dots for people. But that's why I have a great resource in you. But yes, let everybody know who you are, where they can find you.
So again, Dr. Nicole Lorenz, physical therapist specializing in orthopedic and pelvic floor physical therapy, also Pilates certified. I'm here in downtown Plymouth, and you can find me on Instagram at Refined Physical Therapy.
Nice. Is that your website too?
Yeah, refineptwellness.com.
Perfect. We will see you next time. And again, if you want to see Nicole back on, which I know you will because I already want her back on, let us know what topics around pelvic floor you would like us to discuss next. Or maybe we should even throw like a Q&A out there and
Q&A would be great.
Ask
I'd love
the
to know what people are wondering.
I might have a couple questions in there too.
Throw them in there.
All right. All right. I don't have an outro yet. We'll just cut her there. We're learning.
Do you have music? Like, do you have a theme song?
Yeah. I'll throw something in there.